I'm Dr. Jaydip Ray Chaudhuri, Head of the Department of Neurology in Yashoda Hospitals. Migraine is an episodic headache disorder. It causes episodic and recurrent headache which causes throbbing tendency along the forehead, and sometimes it can happen in the back of the head also. It can happen around the eyes, around the nose and on the face, but mostly it's around the forehead and on the back of the head. Sometimes it is associated with vomiting feeling, nausea, and sometimes they have reduced sleep. Some people often get agitated. Whereas in sinus related disorders, we see that person has lot of allergic issues, they have watering of the eyes, they have their symptoms early in the morning, and when they put their head down, they had more headache. Usually the sinus headaches are along the forehead, along the cheeks, and sometimes deep inside the nose and often behind the ears. So the areas of sinus and the migraine headache overlap, but there is a distinct feature between each of them. We had a patient few days back who had continuous throbbing headache. Initially it was coming and going, but after some time it becomes continuous. Actually, we went ahead and did one MRI scan of the brain and the sinuses, and we found that the patient has significant sinusitis. So we referred the patient to the ENT doctor. They told us that yes, there are sinus related issues, and so they treated the sinus problem. The sinusitis subsided, but intermittently the patient went on having the same headache. But this time the headache is most on both the sides of the head, and it doesn't have any nasal discharge. So then, though the MRI was normal, we thought that probably it is migraine and started the patient on anti-migraine therapy. But after some time, patient get better and a number of headaches per month came down. Earlier it was around 6 per month and it dropped down to 1 per month. So both the sinus and the migraine headache can sometimes be there in one single person, but their symptoms sometimes can be different and each has to be treated separately.